My surgery experience with Dr. Brandon Lambiris, West Coast Plastic Surgery, Sarasota, Florida. I entrusted Dr. Lambiris at West Coast Plastic Surgery with two significant procedures, confident in his ability to perform both surgeries effectively. When I consulted with him, I explicitly asked if he could handle both operations as a young surgeon, and he assured me that he could. Unfortunately, the outcome of my surgeries did not meet the expectations he had promoted, and I have been left with damage that may never be fully repaired. I'm sharing my experience to remind everyone that when choosing a surgeon, it's crucial to prioritize expertise and experience over reviews or sympathy, especially for complex or reconstructive surgeries. Reviews can sometimes be misleading and may not accurately reflect a surgeon's true skill. Despite the unsatisfactory results of my surgeries, which Dr. Lambiris was aware of, he has not responded to any of my correspondence regarding the poor outcome, a refund, or even a copy of the documents I signed before the procedures. I now feel like I underwent surgeries without receiving the promised level of expertise. A refund is the only way I might afford the corrective surgery I now need, and Dr. Lambiris is fully aware of this. This is what I was told about Dr. Lambiris during my first visit to West Coast Plastic Surgery. Dr. Lambiris is an artist, talented, down-to-earth, and very ethical. I was assured I could trust him to deliver the best work. However, the reality of my surgery is shown in this video. There were no surgeons I visited, either prior to or after Dr. Lambiris' surgery, who quoted $3,900 for the anesthesia procedure. Neither non gave me a time frame of 8 hours, 40 minutes. Additionally, they all confirmed that the estimates they provided were fixed. This surgeon left me under anesthesia for 8 hours and 40 minutes, and even with that extended time, Dr. Lambiris failed to properly perform either the abdominoplasty or the breast implant exchange. Fact of my tummy tuck performed by Dr. Lambiris. In this photo, you can see that before Dr. Lambiris' intervention, my breasts were completely aligned and I only needed an implant exchange. Paying for an abdominoplasty was intended to remove the loose skin from my pregnancy and get rid of an old scar. A full abdominoplasty is a procedure designed to improve the abdomen by removing loose, saggy skin, flattening the abdominal wall to eliminate bulging, and contouring the flanks and hips. The goal is to remove as much loose skin as possible in a vertical direction, ensuring the abdomen is as tight as possible. If this principle isn't followed, it can lead to bunching of the skin at the sides, commonly referred to as dog ears. I ended up with a scar, 2 dog ears, same loose skin, but this isn't the surgery I paid for. I paid for a full abdominoplasty to remove my hernia scar and the loose skin above my belly button. Now I have a longer scar below my belly button and more loose skin. I am allergic to latex adhesive, and Memorial Hospital has been very cautious regarding this concern. Unfortunately, Dr. Lambiris was not as careful. The day after the surgery, he applied a pad on my belly that had a type of adhesive on the back. As I had specified prior to my surgery, I immediately began to experience itching and bleeding in the days following the application of this pad. I tried to explain my concerns to Dr. Lambiris regarding my abdominoplasty and breast post-surgery. I felt that my issues were not understood. Despite my efforts to clarify my situation, his response was, "X, I am sorry, I don't understand what you want to explain to me," which left me feeling confused and frustrated. Everyone around me at the time understood what I was trying to convey, making this experience even more discouraging and depressing. I expressed my concerns regarding the pain I experienced in my left breast to Dr. Lambiris after surgery. Despite my complaints, he initially denied responsibility, and it took nearly 3 weeks to perform an ultrasound. The results showed that my nerves were weak, but his response left me stunned. Thankfully, my primary care doctor took over and diagnosed extreme inflammation of the intercostal nerve in my rib cage, providing the appropriate treatment. The following photos show the outcome of the surgery at 12, 14, and 17 months post-operation. The results continue to deteriorate and the appearance of the surgery is worsening over time. Enduring significant pain and experiencing the deterioration of your body after a surgery is a deeply distressing situation. When considering a surgery with the potential risks of long recovery, pain, and possible body degradation, Would you agree to pay for further procedures, or would you ask for a refund? My ethic is when you are unable to provide the service that someone paid for, being honest and acting with integrity is essential. Ethically, you should refund your patient, especially when the procedure has degraded her body rather than improving it. I visited several surgeons after my surgery to understand the necessary procedures and associated costs to correct Dr. Lambiris' work. The estimates I received for reconstructive surgery planned for 2024 ranged from $16,000 without an implant exchange to $20,000 to $25,000 with an implant exchange. Unfortunately, I cannot afford these costs financially. During my painful and frustrating recovery, I received numerous emails urging me to vote for Dr. Lambiris as Best Surgeon of the Year of Sarasota in both my primary and secondary email accounts. While this may serve as effective marketing for his practice, I was in deep emotional distress at the time, overwhelmed with pain and frustration as I dealt with the disappointing results of my surgery. Given that he had only been in practice for 18 months, and after researching and finding excellent surgeons in Sarasota, my own experience as a patient was far from satisfactory. These emails felt intrusive and out of touch with my reality during an already difficult recovery period, which only added to my frustration. It seems, in my case, Dr. Lambiris has forgotten the core principles of the fellowship pledge he committed to. I pledge to pursue the practice of surgery with honesty and to place the welfare and rights of my patients above all else. I promise to deal with each patient as I would wish to be dealt with if I were in the patient's position, and I will respect the patient's autonomy and individuality. The American College of Surgeons, ACS, Fellowship Pledge is a commitment to patient welfare and the practice of surgery with honesty. It emphasizes the importance of placing the patient's rights and well-being above all else, treating them with respect and individuality, and dealing with them as you would want to be treated. It's been 17 months since I underwent surgery with Dr. Lambiris at West Coast Plastic Surgery. Looking back, I feel incredibly disappointed and frustrated with the outcome. Despite my initial confidence in the procedure, the results didn't meet the expectations he promoted during my first visit at his practice, and I'm left dealing with both the physical and emotional impact. The surgery degraded my body rather than improved it. This has been a difficult and unresolved experience. I would appreciate your honest opinion on the following. What do you think about the outcome of this surgery? What would you do if you were in my situation? Do you think it's acceptable for the surgeon to keep the money given the results? How do you feel about the surgeon not responding to my few attempts at communication? Thank you for taking the time to share your thoughts.